unworkably.
You're all gonna die!
Okay.
Who's that? Democrat from Maryland, Elijah Cummings.
Yes, he joins us here in the studio. Congressman Cummings is a member of the Joint Economic Committee as well as the Task Force on Health Care.
What the hell are you going to do with those blue dogs?
And are the insurance companies villains?
Seriously, what are you going to do with those blue dogs?
Well, you know, I'm not so much worried about the blue dogs. We're a big party, Joe.
You are a big party.
And basically what people are seeing is legislation being enacted. But the fact is like the president says, we are a lot further along than we've ever been. And a lot of people are talking about us going out on recess and getting hammered. Well, guess what? I had a town hall meeting the other night, and once I had a chance to explain this to my folks, I'm not saying everybody was happy, but they had a lot more optimism and they saw the other side of it.
Do we still have Crazy Lawrence on the set?
Lawrence O'Donnell is here, if that's what you mean.
Yeah, hey, Crazy Larry, who also sells appliances in 5 boroughs. You know, Crazy Larry, let me be a bit more optimistic than you, and I'll side with Elijah Cummings. 1995, as you know, we Republicans tried to enact Medicare reform. We were trashed, and then I went back and I started doing the town hall meetings, and that's all I talked about for about 6 months. And in the end, not only did we sell the bill, but seniors 65 and over voted for us in larger chunks than they had even in 1994. Is there no possibility that the Congressman's right that Democrats could sell this health care bill at town hall meetings?
No, because you have to sell it in a much bigger forum than that and in much bigger audiences. And there is no model. Because, Joe, what you're talking about really was basically a bunch of Medicare cuts that basically was sold as future solvency of Medicare. In other words, you got to say to your audience who was living on Medicare, this is good for you, this is good for the system that you're on. And so what we simply do not have a model of a large social program like this being won by going out on the road and selling it to people. It failed for Hillary Clinton. It failed for George Bush on Social Security reform. There is no model for doing this.
I like him, but I disagree with him.
He's great.
Yeah, I want him to come out with me and watch me in action when I begin to talk to my constituents about the way, and I go home every night, by the way, I live in Baltimore, about how they're being dropped from their insurance, how they cannot get insurance because of pre-existing conditions. Small businesses can't afford to give their people insurance. And so the fact is that I guarantee you, Lawrence, we're going to sell it.
Oh, you
and
can't.
It's going to be strong.
Your district is no problem. The problem is Claire McCaskill can't sell it.
But we're going all over the country, Lawrence. We're going to sell it because it's what's right.
Not in Missouri, you're not.
Watch us.
Okay. Let me ask you about the Blue Dogs. Washington Post reporting today a lot of financial ties between some of the medical special interest groups.
I read that.
And these Blue Dogs. Does that put more pressure on the Blue Dogs because it makes them look like they were bought off by moneyed interests?
I think it does put a lot of pressure on the Blue Dogs.
Are the Blue Dogs unduly influenced by moneyed
I would
interests?
never say a member of Congress is unduly influenced. I do believe, though, however, that the Blue Dogs need to listen to their constituents who are losing out and who cannot get the care that they need. And they need to listen to what these insurance companies have been doing with regard to cutting people off of coverage.
You just brought up insurance companies. You can read this.
Nancy Pelosi, House Speaker, saying that the insurance companies are villains who are carpet bombing public opinion and they're immoral, she adds.
Well, again, Nancy Pelosi is my speaker and I respect her. But the fact, and I do believe that when you read the Washington Post article this morning, too much money is being spent. I think the Blue Dogs are going to put themselves in a position where their constituents are going to be asking them questions.
Are insurance companies immoral?
Would you say that?
Would you agree with Nancy Pelosi?
I think some of the things that the insurance companies are doing are very, very unfortunate.
Are they immoral? Are they villains?
I think that in many instances they are bringing great harm to the American people by denying coverage.
Immoral? Do you agree with your speaker? Are they immoral?
I think that there are instances where they act in an immoral way.
Are they villains?
What I'm saying
are they villains? Are you a lawyer?
Let me say it to you, Joe.
I'm not kidding.
Joe. The insurance companies are reaping phenomenal benefits. People are dying, Joe. They're literally dying,
right.
and they are suffering needlessly. And I think that they could do better.
All right.
And many of the decisions are probably immoral.
Okay, Pat, I'll let you go. Look, you go home to your constituents and they're being dropped off their insurance and they don't have coverage and all these other things. That's your constituents. This holds out tremendous promise for them. But we've been talking about the other side now, which is the apprehension and fear on the part of people who got good health insurance and would like to have other folks taken care of. But they say, wait a minute, we're going to get taxed, and now we're hearing all this stuff about people at the end of their life are going to get visited by some guy.
And see,
so all these things, the
and that's the sad part. That's why we've got to straighten out some of these untruths. Some of these things are actual lies.
Are you saying you do not have the Grim Reaper clause in this health care bill?
No, we don't.
They're all saying the Grim Reaper.
That is absolutely untrue.
I think that if I were you, that I would emphasize. I have excellent health insurance with the Washington Post, but our plan has been changed. It gets changed every year, and it always gets changed in a way that I have to pay more money.
That's right.
For a little bit less of it, and that happens every year, and it happens to everybody who still has care.
10 seconds. Are the Blue Dogs unduly influenced by money?
Well, sure.
Okay, but you answer that quickly. The next question. Do you think Nancy Pelosi calling insurance companies immoral? Do you think that was a wise political move?
I do not.
I don't either.
I don't think so. I think I would have phrased it differently.
All right. Congressman Cummings, I love you.
Love you too.
We worked together for a very long time on the Civil Service Committee. And actually, speaking of health care, we gave long-term health care benefits for the first time to federal employees.
That's
now,
right.
that worked.
That's exactly. We did that.
Right here.
We did that.
Right here. Right here. Bill Clinton even said it was landmark legislation. We worked together.
That's right. That's right. You remember?
I, of course, had to fire all of my staff members to get it done, but we did it. All right. Coming up next, we got CNBC's Erin Burnett. She's got to look at business.